Hello, Brazil. I'm Dr. Peter Banks, and I'm delighted to give you this overview of the session that we just completed entitled Acute Pancreatitis, New Developments Which Are Improving Outcomes, which I found as a co-moderator a very exciting session. Dr. Beechin Wu gave an excellent presentation which he entitled The First 24 Hours. And in this session he explained to us all the variables that we should be keeping in mind in terms of the care of the patient in the first 24 hours, and pointed out how critical it is to pay attention to things such as fluid resuscitation, to be aware of the importance of infections in the first 24 hours, and importance of early nutrition, and made the point that in severe acute pancreatitis, early nutrition and early is critical to stave off the complications of acute pancreatitis and to improve mortality. Dr. Timothy Gardner gave an excellent presentation on endoscopic management of complications, and he pointed out how important it is for us to be aware of the differences between what we call fluid collections, what we call post-necrotic collections, what we call pseudocysts, and what we call walled-off necrosis, and explain the types of intervention that might be possible in these various entities. It was a very important talk, and it explained in some detail the importance of the therapeutic endoscopist in the management of patients with severe acute pancreatitis. Then Dr. David Witkin gave a presentation entitled Stratifying Risk Using Genetic Markers, which is the future of acute pancreatitis. And it was a brilliant discussion, a brilliant talk on how genes really play an important role in the natural history of acute pancreatitis, and explained to us how, as we go forward, this is going to take on increasing importance in our ability to supervise patients and even predict which patients are going to have acute pancreatitis before they have any pancreatitis at all. So all in all, I was very stimulated by this. I took notes. I think other members of the audience took notes, and I found it a very, very productive and exciting hour-and-a-half presentation.